This is part 7 of our series of drug of choice. In this, I intend to cover the following important rheumatology topics. So let's get started. The first one on our list is osteomalacia or rickets. It is called osteomalacia in adults while rickets in children, caused by demineralization of the bone. The most important treatment for this is calcium and vitamin D supplementation, as the main cause is the deficiency of vitamin D. Osteoporosis, on the other hand, is defined as decreased bone mineral density. It is usually observed in the elderly and makes them prone to bone injuries or fractures. The first line treatment is the same, vitamin D and calcium supplementation. The treatment depends on something called the T score, which is found out on bone densitometry scan. A T score of minus 1.0 to minus 2.5 is considered osteopenia, and this requires vitamin D and calcium supplements. However, a score of less than minus 2.5 confirms osteoporosis, and in this, it is advised to start bisphosphonates. Next in line, we have osteoarthritis. This again is a disease of the elderly. We can observe a decreased joint space and worn out cartilage, which are important findings in this disease. Also, it affects the larger joints when compared to rheumatoid arthritis. The first line drug used is NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, diclofenac, naproxen, etc. Along with this, vitamin D and calcium supplements are also helpful. In cases of severe pain, analgesics are used. These may include painkillers like opioids, example tramadol. Regular physiotherapy is advised in these patients, but only after the pain is under control. Intra-articular steroids may be used in acute situations, and if nothing else works, joint replacement may be undertaken. Let's move on. Rheumatoid arthritis, characterized by the inflammation of joints and the synovial membrane. There is cartilage degradation and bone erosion as well. This, unlike osteoarthritis, is usually found in the smaller joints of the body. For this, the first line treatment is steroids. However, steroids have several side effects when used long term. So we move to drugs called DMARDs. These are disease modifying anti-rheumatoid drugs. Generally, methotrexate is the first DMARD used in these cases. If the disease progression is not being controlled and the symptoms persist, we go for a combination of two DMARDs. Example, methotrexate with azathioprine. Even if this doesn't work, as a last alternative, we go with TNF alpha inhibitors. Example, infliximab. It's important to keep in mind that these drugs take weeks to months to show their effects, so patience is key. Also, in certain cases, rheumatoid nodules may be formed. For this, only surgery is effective. Next in line, we have ankylosing spondylitis. Classically presents with low back pain and fusion of vertebrae. The first line treatment is physiotherapy. This is essential to improve the flexibility of the joints. As second line, we can add NSAIDs for pain management. As third line, steroids or tricyclic antidepressants like amitriptyline may be used to help reduce the pain. Even if this doesn't work, TNF alpha inhibitors may be used. Etanercept or adalimumab are the preferred ones. Also, an important thing to remember is that if DMARDs are added, they can only help with peripheral joints, so they are not very effective in improving back pain. Next, we have two different types of epicondylitis. Lateral, which is also known as tennis elbow, and medial, which is also known as golfer's elbow. The treatment for both of them is same and includes rest with ice packs. And once the pain is controlled, physiotherapy is started. Second line treatment may include NSAIDs or GTN patches. Next, we have carpal tunnel syndrome and de Quervain's TENOSYNOVITIS. The treatment for both of them is the same. The first line is analgesia or pain relieving medication. Second line includes steroid injection. And third line includes wrist splint or thumb spica. As a last alternative, surgical decompression is undertaken. Lastly, on our list, we have juvenile idiopathic arthritis and adult onset Still's disease. For JIA, IL-6 inhibitors like tocilizumab or steroids. are found to be beneficial. Other options include NSAIDs or steroids or methotrexate. For adult onset Still's disease, IL-1 and IL-6 inhibitors both are helpful. IL-1 inhibitors include anakinra and IL-6 inhibitors include tocilizumab. Tocilizumab is the drug which was being used in patients infected with COVID-19. The rationale behind its use was to suppress the immune system, as IL-6 plays an important role. With this, I conclude this video. Hope you enjoyed it and found it useful. Thanks for watching. Stay tuned for more videos like this.